All right, so we are here, and being a Monday, you know very well that we discuss matters health. This time around, we focus on child immunization and vaccination. Very, very important subject. Dr. Emily Maranga, who's a pediatrician as well, that is at the Avenue Hospital Parklands, joins us for this very important conversation. And while we all understand immunization and vaccination is key, there are instances where you'll find guardians not really keen on that, and they would want to overlook that, especially for those ones that have given birth at home. Dr. First of all, to take us to this very conversation, just what is the essence of vaccination and immunization before we speak to those ones actually that would tend to ignore?
Okay. Thank you for inviting me to this show, and thank you for your question. So immunization and vaccination is a very important topic when it comes to pediatrics and child health. And when we talk about immunization, it's the process of the body getting immunity from receiving a vaccine. And you talked about the patients who may have delivered at home and have not yet accessed the hospital. So we usually advise that as soon as the baby is delivered, they're taken to the nearest center, the nearest hospital that can offer vaccination to that baby, because that initial protection is very important for the baby when it's given in a timely manner. Okay.
Yeah. And so when you talk about vaccination and immunization, any distinct difference, or they're one and the same?
The terms are used interchangeably. Yeah, vaccination is the giving the vaccine into a human. Yeah, and immunization is now the process of acquiring immunity through the vaccine. Yeah, but the two are used interchangeably.
All right. Yeah. So let's talk about child immunization and vaccination. And like you rightfully put it, there are timelines to this, that, you know, some of this should be administered, you know, timely, like you started by saying. What would be the dangers of not getting this, you know, at the right time and all that?
So first of all, globally and nationally, we have a schedule, immunization schedule, that informs us when to give which specific vaccines. And this is from years of research that has been done to show the effectiveness of the vaccine at the time it's given. So in Kenya, we have the KEPI schedule, which now follows the WHO guidelines. And with the KEPI schedule, starting at birth, going into 6 weeks, 10 weeks, 14 weeks, and then now spaced out going into the 9-month vaccination. And in between there are other additional vaccines that when you come to the pediatrician, or in this case, to your nearest facility that is giving vaccination, you're able to be guided on the immunization schedule that the baby should follow. But it's standard. For Kenya, the KEPI vaccination is standard from birth all the way up to 9 months, and additional vaccines thereafter. All
right, so what are these types of immunizations and vaccinations, so to speak, that are there? At least for the child, for the young ones, when we say now, well, immediately after giving birth, say when you were at home, find your way to hospital for these obvious reasons, for this vaccination or for this vaccine.
So if we go through the KEPI schedule as it is, I'll just walk you through it. So from at birth, the child should receive BCG. So BCG protects you against TB. And then there's polio vaccine, the oral polio vaccine protects you against polio. And then we also have the hepatitis B vaccine. So those three are usually given together at birth. And the different ways of giving the vaccine, there's the oral and there's the vaccines that are given as injectable forms. So after birth, you're given an appointment to come at 6 weeks. So at 6 weeks now, you receive pentavalent vaccine. Penta means 5, so it protects you against 5 diseases. So here we have DPT, so that stands for diphtheria, pertussis, and tetanus. So protects you against those 3 diseases. And then now you also have the Haemophilus influenza type B included in that. and then the hepatitis B again. And now that forms the pentavalent, which is given as one injection. And then on the next, on that same visit, you get the pneumococcal vaccine, which is given as a second injection, but on 2 different sites. Then apart from that, you get the oral polio vaccine as a second dose. Yeah. Then the same pentavalent pneumococcal and oral polio is repeated at 10 weeks and at 14 weeks. So that 6 weeks, 10 weeks, 14-week schedule has to be strictly followed in those timelines so that to give the baby the best protection that they can get.
For those that are watching us, we have gotten to the last level of it, right? So what are the essence, what is the importance of child immunization? The essence of child immunization is to give the baby that protection against these killer diseases. So the vaccines that I have mentioned protect you against the killer diseases that actually, if a child was left not vaccinated and they got this disease, the child may not reach their first birthday. Yeah, and as parents, that is something you do not want to expose your child to. So that's why it's been very throughout since the 80s. We've been following the KEPI schedule and strictly adhering to immunization for all children, even if they're born at home, when they're born at the health facility. So as healthcare workers, we are responsible to sensitize the community and the patients who come to us the importance of immunization, because these diseases, for example, tuberculosis, is preventable. So if you do not give your child a vaccine, you're exposing them to the killer disease. Same to pertussis, which is the whooping cough. And there are some diseases like polio, which globally we want to eradicate. Yeah. So these are diseases which require that every child born is vaccinated against polio and against measles and rubella and the diseases that are for eradication. All right, so they say that sometimes you get to experience side effects, or a child gets to experience a side effect. What are some of them, and just how can they be managed anyway, such that for every child there's not a condition then that culminates from them being immunized?
Okay, talking about the side effects of vaccination, majority of them are minor side effects that should not prevent the child from getting immunized according to schedule. Some of the side effects include fever. The child can get a low-grade fever. The child can get a bump, like a small swelling at the site of injection, but the bump should not progress. And for those of us, majority of the population in Kenya received the COVID vaccine. So you remember the side effects at the site of the injection. So the same thing would apply in a child. If the baby is injected on the thigh, you can get a small bump or swelling that usually goes away on its own. And the fever also goes away on its own within the first 48 hours.
48 hours. So you're saying that within 48 hours, if baby is unsettled beyond that point of immunization or beyond such levels, then you need to get concerned?
It will be good to see.
It's on rare occasions, but it would be good to perhaps maybe go back to hospital and seek advice?
Yes, it will be good to seek advice from a professional. So that is your pediatrician or at the vaccination center where you are. So for example, at the Avenue Parklands Hospital, our Well Baby Clinic is integrated with our pediatric services. So if there's any issue, if a parent reports any of those side effects, they immediately come to see the pediatrician, and we're able to advise whether this is an adverse event, if the fever is something to be concerned about, or sometimes you find that the fever is occurring due to another illness that the child may be having during the immunization period. Yes. So
okay. So in this case, sometimes maybe a child could be having another illness, maybe they are on antibiotics, and sometimes I'm even told that, you know, especially when it's about injection and it comes along with some bit of uncomfortable moments after, then you're told, could you give them some painkillers prior and maybe after the injection? Does it work?
When it comes to, let me take your first question.
There are three things in this. First of all, one could be under some medication. So is it in order for them to proceed and get vaccinated, or should this be clear to the medic who's handling them? And if they can take the same and with, while they are on antibiotics, and equally, when you are going for vaccination, especially those ones that involve injection, the pain and the fever and the unsettled moments that come along with that, is it in order to do painkillers prior for the kids?
Okay, so let me take the first aspect where the child is unwell before, during the period when the child is supposed to be immunized. So the minor illnesses are not factors that will make you stop immunization. So all children should still be immunized, despite them having minor illnesses. And when the illness is a concern to the person, let's say the well baby nurse who is attending to the patient, the patient is now referred to the pediatrician. So as a pediatrician, I will assess the baby and I will see if the baby is fit for immunization. If the baby is sick enough to be hospitalized, then we first treat the illness that the child has come with, and then on discharge, they have to be immunized as per the schedule before they go home. So this avoids missed immunizations because children will still have the common cold, children will still have a bit of diarrhea here and there. So that should not stop us from giving the immunization on schedule. And then on your second part where you talked about the uncomfortable moments, those are expected to happen. As I said earlier before, when you have that small bump, you can do cold compresses, on the site of injection. It's not cast in stone, but you don't necessarily have to give the painkillers before the injection. We actually advise the baby just comes as they are, get the immunization, and after observe the baby. It's not necessary to give the painkillers or the paracetamol immediately after the vaccination. You can observe the baby because there are some who do not get those painful moments. Thank you.
All right, safety of the vaccines. I know you could say they're standardized across the global fraternity, but there are instances where you even find churches are against the vaccine because they question the safety. Just what is the guarantee that some of these are safe 100%? And even those ones that are introduced, like for instance, you'd say COVID-19, most of the babies I know did not get COVID-19, but there will always be questions revolving around the safety of these vaccines.
Yes, with every kind of vaccination comes questions. And of course, as a parent, you're concerned whatever your baby is getting, how it would affect your baby and all that. But this immunization, the process of manufacturing the vaccine has gone through so many steps of quality assurance that makes sure the vaccine is safe to all the babies globally. So the vaccines that we receive here are no different from the vaccines the babies in Britain receive. And the quality measures are checked by UNICEF, WHO, and the vaccines that we receive here, be it KEPI, be it the baby-friendly vaccines, they are safe for your baby. The side effects that occur are easily manageable. There are times we get adverse events, like a vaccine reaction that involves the entire body. So for that, for those specific times, we have that investigated, the isolated adverse events investigated. But all the vaccines that are given currently are safe for the babies. And the myths that go around, be it spread by some religious organizations or by individuals, should not discourage parents from giving their babies vaccination, because the moment you miss that window of immunization, it means if your baby got for example, got measles and had not received the measles vaccine, your baby is at high risk of getting the full-blown severe infection and could actually may actually not survive the infection. That's why immunization is very important, so that the body is able to produce the antibodies required when that infection comes, and now the body is able to protect itself and the baby is able to survive.
And so this baby is completely immune to this very disease, and therefore you can be sure that in the event it strikes, they are well protected, 100%.
We do not, in immunization, we do not give the 100% assurance, but it gives you more than 90% protection to severe forms of the disease. So whichever vaccination is being offered, let's say, for example, the measles, let's just use the measles vaccine again as an example. So if your child has not received the 9-month vaccine, and there's usually a booster at 18 months, that's measles 1 and measles 2 at 18 months, then it means your baby, if they do get measles, they may get the severer form of the infection. But if they had been vaccinated, they are better protected against this disease. It comes and the child may get the mild symptoms, and the child is able to fight it off.
All right.
Yeah.
And they say that sometimes you go and some of the vaccinations that you've spoken about, you find that you have to take more than one at a time.
Yeah.
Not an expensive affair, and some people would ask, why is it that they have to take more than one in one simple visit? Why not spread?
Okay, so taking there are two parts to this question: the financial aspect and the co-administration. We call it co-administration of vaccines. So from the vaccine schedule that we have, both globally and what we use nationally, the way the vaccines are manufactured, they can be co-administered. For example, you see the ones at 6 weeks, 10 weeks, and 14 weeks. The child is getting 2 jabs and is also getting the oral rotavirus vaccine and also getting the oral polio vaccine. So it's safe and it's still effective to have those vaccines co-administered, because that is the window of protection that we need to capture before the baby grows up. Yeah. Okay. The second aspect, the financial bit, in our facility at Avenue Parklands and across the facilities that offer vaccination, the KEPI vaccines do not come with a charge. The only charge you may get is for registration and for the other baby consultation that the baby gets. When you talk about the other additional vaccines, those are the ones that now come at an extra cost, because they are from the private manufacturers, but they still have the same ingredients that the KEPI vaccines have. Okay. Yeah.
All right. So someone is asking, will my child get sick if I don't immunize him or her? And what happens during an outbreak if my child is not immunized? I think more or less one on the same question.
Okay. So the first part of the question is, will my child get sick if they're not immunized? So the chances are high that if, for example, your baby is at, let's still use the example of 9 months, and has skipped the measles immunization, and then there's an outbreak of the measles immunization, your child is likely to get the measles disease, and they're at higher risk of getting the severe form of infection. So for our viewer, it's very important that we adhere to the schedule that is given, because it guarantees your baby protection against this disease at whatever time it attacks. Yeah, and for the second part of the question, where they're asking you
whether there's going to be if there's going to be an outbreak and they have not been immunized, is it then something that is for sure they will get the disease?
Okay, so for the diseases that have maternal antibodies passed on from mother to baby, usually in the first year of life, you find that the maternal antibodies protect your baby against this disease. So the way the immunization schedule is put is such that once the maternal antibodies have started going down, the baby has already is already in time to receive the vaccine. So if you did not miss it at the time it was supposed to be given, then your baby is protected if your baby got the vaccine at the time it was supposed to be given. But if they missed it and then there's an outbreak, usually we have the government and the Ministry of Health organizes the outbreak response. This is where we have the supplemental immunization activities, and healthcare workers are trained, and we go out to the community, and the vaccines are also brought to the hospital. So all the vaccination centers that are allowed to give vaccines, we get those vaccines, and we're able to give all the children at risk. Yeah. So the most recent one was in, I think, in the month of December, where there was a measles outbreak response. And in that period, all children who are at risk between 9 months and 59 months were able to get the immunization as part of the outbreak response. But still, those who were due for their immunization received the vaccines as scheduled.
So it means, perhaps what someone is asking as well, what then happens in the event that they get the vaccine behind schedule, and you have really been insistent on the question of time?
So that's where there's an opportunity for catch-up immunization. Yeah, and we advise parents, especially in the first 2 years of life, because that's where majority of the immunization is given before 2 years of life. So if the baby, let's say for example the baby was born at Avenue Hospital in Parklands, they received their vaccination at birth, and then they're given the appointment to come at 6 weeks, 10 weeks, 14 weeks, and still after that they come on a monthly basis, so that we're able to weigh and monitor. We weigh the baby, we monitor their growth and development, and we remind them of their next appointment, because let's say the interval is about 3 months between the last vaccine and the next one. So of course, as a parent, you may need a reminder to come for your immunization. So as long as the schedule is followed, your baby is protected. For those babies who have missed, we are able to catch them as soon as they come. For each visit to the hospital, we also do the sensitization to the community. When the baby comes in and we look at that booklet, the mother-child booklet that has the immunization page, we're able to see baby missed this vaccine, especially the time there was rotavirus vaccine out of stock. So how do we do catch-up? So we're able to advise them at that point, this is how we're doing the catch-up vaccination. So your baby still receives the vaccines that are needed, but now with a catch-up schedule.
And I'm glad you mentioned something to do with the booklet, which we need to understand some more, because again, we started by asking those ones that have given birth at home, when they come to the clinic, outrightly they're given the booklet, or what plays out and what is the essence of the booklet. So allow us to take a quick short break, and then we come back, expound on that. Amy.
Okay. Thank you.
The home of untold stories. Looking for a college that will impact your practical skill sets? Tristan School of Medical Health and Science Technology offers market-driven programs in diploma and certificate levels in the schools of health sciences, social sciences, applied sciences, and business and informatics. Enroll for our January 2023 intake to enjoy seamless student experience. You deserve qualified faculty leadership to set a good guide for your career. Tristan School of Medical Health and Science Technology, partners in your journey.
All right, welcome back to the broadcast. Dr. Emily from Avenue Parklands is here with us. That is Avenue Hospital, as we discuss the essence of vaccinations as well as immunization. And we have gotten to that space where we've understood the difference between these two. And here we are expounding it further. We have looked at the importance of the timelines, but people then will raise questions. Maybe someone wants to travel and they're not sure whether they're going to get immunization on the other side. Is this a global practice? And if a global practice, are there instances where you can decide to give this child, you know, the vaccine prior to the due date? And is there anything wrong with that?
Okay, so let's take the first part of the question, where we're looking at the immunization card or the immunization booklet. So this has listed all the vaccines and the time that they're supposed to be given. So this gives parents information prior to even delivery. Yeah. So you see, the mother to child booklet has the part for the obstetric care when the mother was still pregnant, and now after the baby has been born. It has information about taking care of your newborn all the way up to 5 years, feeding practices and all that. The immunization has 2 or 3 pages where all the immunizable diseases have been listed with the type of vaccine that is being given at what time. So when you attend our antenatal clinic at Avenue Parklands Hospital, you're able to access that. You'll be given the mother-to-child booklet, which you carry through your pregnancy into the newborn period. That's when now we start recording the immunization from the time the baby is born and with all your follow-up appointments. If you had missed the antenatal part and you're coming in for your first vaccination, then as soon as the vaccination is given, we have to keep a record of the baby's immunization. So there's the hospital record of the immunization, and then now the immunization card that comes to you as a parent with a record of the vaccine that you've been given, the date it was given, and even the batch number and the details of the vaccine, so that the next appointment you're coming to get your next baby's immunization, we are able to follow up and see if there are any missed immunization, to see if there are those children. Now, you mentioned that if you're traveling outside the country or to a different area and you're not sure, then as a pediatrician, we're able to advise which vaccines you can access. And depending on the country you go to, there's some vaccines that are given in certain endemic countries. Let's say, for example, yellow fever, that is given in Kenya, but it's given in those endemic counties where we have yellow fever. So if you're going to another country that does not have that endemic disease, then we'll advise you accordingly that your child may not be able to get this. But if they are the age where they can receive it before you leave, then we'll be able to give it. But if your baby is still protected, you remember we talked about the maternal antibodies, and if your baby is still protected and it's not yet time to give that vaccine, then we don't have to preempt and give it before. We can now plan ahead, depending on where you're going and when you're coming back, so that now we can keep it on track. So it's good that when you come for any hospital visit, please carry your immunization card, and if it's part of your MCH, the mother-to-child booklet, so that we are able to check that your baby has received all the immunization that is required, so that you're fully protected.
Yeah. So that means it could be the basic ones that we've talked about are standard across the globe? The global paternity?
Yes.
Okay, so you need not to worry as a mother that maybe you've given birth in 2 months, you have to travel to a different country, settle in a different country. You still get the immunization as you would have gotten in your own country.
Yes, for the diseases that are a global problem.
A problem.
Yeah, but those that are endemic to certain countries, let's say, for example, malaria vaccine, that one now will only be given in the country where it's endemic. When you go to another country, you may not receive that vaccine. So that is where we come in as healthcare workers to advise when to receive those types of vaccines.
I know we talked about the reactions, but let's expound it further and talk about allergies. Are there instances one could get, some proper allergy that you see this child really is allergic to this one?
Yes, there are the times you get the adverse events. Well, we call them adverse events, but they're very isolated. And it will manifest as the baby getting an allergic reaction, the entire body. Yeah, where the baby will get swollen and probably have it's called an anaphylactic reaction. So that one is an emergency. The baby has to be brought to the hospital, and of course emergency stabilization. And then now we go back to find out the batch number of this vaccine from the manufacturer, when it was given, and then now trace back it, and the reporting goes all the way to the Ministry of Health and all the way back to the manufacturer. So there's a way of reporting the adverse events. They do happen, but very isolated. Yeah, they're not in any way a discouragement from getting the proper immunization. Yes.
All right, and I am sorry that we have to go back to this, but it's very important for the people who are watching and asking these questions. It's fine. They say, well, if one can delay, just how extreme would it be? In this case, how far can you go? I'm imagining that's what they mean. How far can you stretch? You say now, after 3 months, upon delay, there's really nothing much that can be done to, to help this child. But 2, 3, 4 weeks delay, not bad. So what is the longest that one can delay?
Okay, thank you for that. So that's actually a very important aspect, because you see that there may be misinformation out there that maybe one individual tells another that if your baby is sick, don't take them for immunization, just wait. But now the parent doesn't know how long am I supposed to wait.
To wait, yeah.
Yeah. So each of the different vaccines has a different timeline. It's not a blanket timeline of 1 week, 2 weeks, 3 weeks. We still advise that we stick to the schedule that is given. In a case where you're not able to come get the immunization, you can call in advance. You can call and find out if you can.
How far you can stretch it?
No, not how far you can stretch it. You can call and find out. Let's say the immunization center was closed, but it's going to be open the next day. You can call and find out when I bring in my baby, will they get the vaccine that is needed? So we have, I'll leave you with a contact, the hospital, Parklands Hospital contact, where you can call in and find out if your baby missed this immunization, when can you come? But what I would advise in general, do not wait at home. If the vaccine was due at 14 weeks and for one reason or another you've delayed by 2-3 days, as soon as you're able to come to get the vaccination, please come and your baby gets the immunization. If you have also delayed for too long, do not be discouraged. Just come so that we are able to now advise you on the catch-up schedule to follow, so that your baby still gets all the immunizations required and your baby is well protected. Yes.
All right. Well, very important questions also cropping up here on how one needs to be keen on the question of immunization. I'm just trying to pick what would be the right one. where can I or my child get vaccinated? I think that is quite an obvious question, but it's important, especially in the country that we respond to that. Yeah.
Yes, it's important because sometimes we don't have the awareness that is required. And you see now the media, you play a very important role in sensitizing the population on how and where to get vaccination for their babies. So the Avenue Hospital has 3 hospitals in Parklands, Kisumu and Thika, and also the outpatient clinics. So if you visit any of our branches and if you visit our main hospital, you'll be able to get your immunization on schedule. The main Well Baby Clinic at the Parklands Hospital runs Monday to Saturday. So Monday to Friday is 8 a.m. to 4 p.m. Monday to Saturdays from 8 a.m. to 1 p.m. Your baby is able to receive vaccination during that period. And you see, it offers a very large window. Even for mothers who are working Monday to Friday, you can still come on Saturday between 8 a.m. and 1 p.m. to get your baby immunized. And still, if you have not, if you didn't get an opportunity now to come to Avenue, you can still get immunization at the government facilities that have been allowed to vaccinate babies. And most of these facilities, starting from even level 3 facilities, are able to give your baby the vaccination. Yes.
All right. So another person asks then, there are instances where I have gone to the hospital to get my baby vaccinated and I'm told that, well, we can do it right now because anaisema na Kiswahili sijui hiyo sanduku ijafunguliwa kwanza, lazima tungoje watoto wengi wakuje. Why is that? I don't know whether you've experienced that.
Yes, so that comes...
That you even have to be told, like you're told to come back tomorrow so that, there's a quorum for this particular box to be opened.
Okay. So that falls under vaccine management, which is a guideline that comes from the Ministry of Health about vaccine management. So all facilities that have been allowed to give vaccines to babies are given a number of vaccines according to their storage capacity. Because you see, these vaccines are not just kept in room air, they're kept refrigerated, and there are some which are even kept frozen. So some of the vaccines are given as a single, like one vaccine goes to one patient. But there are some that now come in a batch of doses. So, for example, the BCG vaccine, it comes in that vial, that small bottle that has multiple doses to give to multiple children once you open that vial. So that prevents vaccine wastage. You see, if one how do I explain this? That one vial can give 20 babies, and then it's opened for one baby. Then the rest of it, has to be discarded. It cannot be used again. Yeah, so that is why for some particular vaccines, the appointments are scheduled in such a way that we have a number of children coming at the same time to be given, so that we avoid the vaccine wastage. But there are those immunizations, those vaccines that come already pre-packed as a single dose. So for those ones, the baby is given as a single dose as soon as they come. It doesn't have to be a number of patients at a specific time. But still, I would like to emphasize that if maybe you've gone to any facility that has told you to wait for the batch to be opened, kindly take the contact of either the specific clinic, and if you're coming to Parklands Hospital, we have our Well Baby clinic contact, so that as a parent, you're able to follow up, but also on our end, we have those records and we are able to call you back to bring your baby to get the immunization. But usually, when you come to our Well Baby Clinic in Parklands, every single day, the babies are getting vaccinated, and you will not come and be sent back. You will come and receive all the vaccines as per the schedule.
Okay. Yeah. Another question, difference between baby-friendly vaccines and kawaida vaccines, or the usual vaccines?
Okay. That's,
I don't know what
yes. I expected that question. So the aspect of, it's commonly misunderstood, but the aspect of baby-friendly versus the term used, regular vaccines, both baby-friendly and the regular vaccines have the same ingredients. The only difference is that from the manufacturers who make the baby-friendly vaccine, particularly for now, it applies for 6 weeks, 10 weeks, 14 weeks, where the baby is getting the pentavalent vaccine. So as part of the pentavalent, there's pertussis. So that's specifically pertussis is the one that can either be given, it's prepared either as a whole cell or as a cellular, meaning they're taking the properties of that cell that are required to give immunity, and then now the manufacturer makes it without including the entire cell. So that's the main difference between baby-friendly and the regular vaccine. The components to provide immunity are exactly the same. The only difference is now that the baby-friendly has less of the immunogenic, it gives less immunogenicity compared to the one that is given as a whole cell. But the studies that have been done worldwide have shown that the effectiveness is the same.
The same, yeah?
Yeah.
Okay.
So we can't say when you give your baby baby-friendly, it's less effective than the Kepi vaccine. No, the effectiveness is the same. The only difference is now the part of the vaccine that has been used to manufacture what is being given. And now for the baby-friendly one, they have less side effects because they've used specific parts of the cell compared to the regular vaccine that has taken the whole cell. Then it will give a bit more of the side effects, but manageable. Yeah, so both are safe, both Kepi, both baby-friendly vaccines, they are safe, and your baby can receive either. Yeah.
You said something to do with maternal protection, more or less. Is this one that falls also under the natural protection, or do babies really have, natural immunity aspects?
Okay. Could you kindly repeat?
You spoken about, was it maternal
antibodies?
Yeah. Does it fall under the natural protection aspects or the natural immunity aspects of a baby? And I mean, if they have these that are strong, do they need vaccination?
So yes and no. Yes, babies have natural immunity because they also have immune cells, but for the maternal antibodies that cross over through the placenta and the breast milk are not for all the diseases that we face in childhood. They are only for a few specific ones. For example, the example I gave was measles. You have the maternal antibodies crossing over from the placenta and breast milk all the way up to 9 months. By 9 months, they have started going down. That's why it's very important now to get the vaccine at 9 months so that the baby is able to produce their own antibodies against the measles disease. So not all diseases have maternal antibodies crossing over to the baby. That's why you see at birth, for example, polio, it does not have maternal antibodies crossing over. That's why we have to give it at birth and continue giving it 6 weeks, 10 weeks, and 14 weeks. And anytime there's an outbreak response, we get the the booster repeat polio doses. And also some diseases have they have a pattern where you would get you have been immunized against a certain strain. Let's use the flu vaccine as an example. The baby has been immunized against a certain strain of flu vaccine, and another strain comes out. The manufacturers make the vaccine targeting that strain of flu, influenza, and then now babies and even adults, they now get the flu vaccine depending on the strain that is currently going around. Yeah, so not all diseases have the maternal antibodies crossing over. That's why we say no baby should miss immunization. And the way immunization is scheduled to start at birth and that follow-up is given is very important. I'll keep stressing on that. It's very important on giving the baby the chance to produce their own antibodies so that when they get attacked by that disease again, they're able to fight it better. And
so that means
they're able to survive it.
Is this protection that is due to vaccination then one that stays for the child or stay, for the child, that is their entire life, they're protected? Are there chances for that? Or maybe there are instances where at a certain point in life then they'll have to get another form of immunization or vaccination?
Thank you for that. So when you receive the vaccine, you get acquired active immunity, because you've been injected with a foreign substance. So your body's immune cells respond to that foreign substance by creating antibodies. So when now the body has created those antibodies, if I was to get a second attack of the same disease, my body is prepared. Like I already have the antibodies. So my body is able to quickly identify. So the baby's immune system is able to quickly identify the disease and mount an immune response that now protects the baby from getting severe form of that disease. Yeah, it means the baby can still get a very mild form of the disease, but protecting you against the severer forms that now lead you to getting hospitalized and can even now lead to death. The second, maybe you can repeat the second part of your question.
I think it was more or less, and that is well answered. Perhaps to go to jump onto another one. Mostly you hear people, I don't know whether it's a myth, they say, well, you are better off go and get vaccination in a private, in a public entity as opposed to a private one. And there are instances where you go to a private entity and you find that they have, they have vaccine that is not available in government ones.
Okay. So
the question is why?
Why we have
that when you go to private providers, they could offer vaccines that are not available in government entities, and equally there are times where you're told you go to government facilities. That is when you can trust the vaccines there, as opposed to those ones that your baby would get in private facilities.
Okay. So an important aspect to note there is that all the centers, all the hospitals, now including Avenue Hospital, all the centers that have been allowed to vaccinate babies, they have to go through the checks by the Ministry of Health so that they have proper storage facilities. They have all the vaccines that are required to cater to the population that comes to be immunized. So you find that in government facilities, they would have the KEPI schedule, which is the one that I had gone through at birth, 6 weeks, 10 weeks, 14 weeks. And then there's the vitamin A supplementation from 6 months, then 9 months measles, and measles 2 at 18 months. So those are the ones that are usually available in the government facilities. So there are those additional vaccines that now are available in private hospitals. So for private hospitals, they would acquisition this from the manufacturers. So still the standard KEPI schedule is followed from birth. The same way the government facility gives the vaccines is the same way the private facilities also give the vaccines from birth, 6 weeks, 10 weeks, 14 weeks. Same vaccine properties and same immunization schedule. But now there are the additional vaccines. So I'll mention some of them. Like at 6 months, there's the additional flu vaccine. Yeah, that now you come and your baby is given at an extra cost. Then there's additional meningitis vaccine. It goes by the name Menactra. So that one is given at around 10 months and has booster doses. Then the additional hepatitis A vaccine, chickenpox vaccine, typhoid vaccine, cholera vaccine. All these are additional vaccines to the main schedule of now what we call KEPI vaccines. Yeah, so those ones are left to parents to choose, and also as pediatricians, we would advise which ones to consider giving your baby as an additional immunization. All right. Yeah, wow. And I've just remembered
we have to close, unfortunately.
I've just remembered one very important part. You mentioned if the babies are fully protected.
Yes.
After the first dose. So I'll still go back to saying that the booster doses are also equally important because the vaccine may wane off after a number of years. Okay. Let's say, for example, typhoid goes down in 3 years and you have to get the booster typhoid vaccine. Same to the pentavalent, 6 weeks, 10 weeks, 14 weeks. Yeah. It has a booster at 18 months. So that's why between 0 and 2 years, it's very important to still keep coming to your pediatrician, keep coming to your hospital. So in this case, you come to Avenue Parklands, we're able to advise you which vaccines need boosters so that you don't stop prematurely.
All right. Yes. Well, thank you so much, Dr. Emily Maranga. I thought that we had not much to discuss.